Welcome to the Iferia TechCast, where we bring you all things science, engineering, technology, and innovation. Today, we are joined by Dr. Walter Bennett, the founder of Elk River Medical, a practitioner with over 20 years of experience bridging chiropractic care, regenerative medicine, and functional health. He takes a system-based approach to help patients restore energy, reverse aging, and live pain-free by treating the body as one interconnected whole. In this episode, we'll explore the principles of regenerative medicine and how to optimize the body's own healing systems. Dr. Bennett, welcome to the show, sir. It's an honor to
Oh,
have you here.
yes, thank you for having me.
All right, so let's dive in. Your career spans over 20 years from chiropractic care to regenerative medicine. So, what was the pivotal moment or insight that made you see the need for an integrated whole body approach instead of focusing on just one specialty?
I practiced as a chiropractor for 7 years, and then I went back to school and became a nurse practitioner as well as a chiropractor. So from there, regenerative medicine just made sense because it's using the body's own cells to help heal itself without drugs or surgery. And that just resonated with me. So that is how I've practiced from then on. So I just really couldn't imagine doing anything else.
All right. So, for our audience of systems thinkers, and engineer. So, how would you explain the core principle of regenerative medicine?
Regenerative medicine, for the purpose I use it as, it's using the body's own cells to help heal a degenerative or arthritic joint. For example, taking the body's own stem cells. I'll take them from either the bone marrow or the patient's fat, take those stem cells, harvest them, put those into the joint.
Hmm.
Once you put the joint, they signal other cells. So we get a rapid healing cascade that
Yeah.
happens. And over the next few months, you know, I've had people come in on crutches or a wheelchair because they could barely walk to they're walking pain free. So it changes a lot of people's lives. And primarily, we do it for knees, hips, shoulders, do a few ankles, elbows, that sort of thing too. But for the most part, it's for joint pain or joint arthritis is what we use it for.
Awesome. So, Dr. Bennett, tell us what at Elk River Medical, you combine chiropractic care, hormone therapy, and regenerative treatments. So, how do these different modalities work together as a unified system? So, is there a specific order or protocol that you follow?
Well, for the body to for somebody to have wellness, everything must be in line. So without without proper hormones, what happens is people won't maybe not get a full night's sleep. If they don't get a full night's sleep, their body won't produce growth hormone to help heal the little micro tears that they experience throughout the day through activities or just living. So we kind of start there, look at the hormone levels. Once we get the hormone levels balanced out, we look at different, if they have different aches and pains, we look at how can we fix that. If a body in motion stays in motion. So
Mm.
if somebody has pains, we address them with regenerative medicine. Or if they have some chiropractic needs, we address them with chiropractic. So basically, whatever the patient needs, we try to be a one-stop shop for many folks.
Awesome, awesome. So, I am curious about the optimization aspect of your work. So when you talk about helping people restore energy, what biological systems are you primarily targeting and measuring to track improvements?
When you look at optimization, I think you can't optimize the body without reducing inflammation.
Mm,
Inflammation is a big factor in today's society, and you get inflammation, and the stressors can be from what we're eating. The soil is not what it used to be, so we're not getting the nutrients that we're used to getting. And people aren't getting food from farms anymore. They're buying food that's prepackaged from a factory. I tell patients, food is not made in a factory, it's grown on a farm. So if you're getting something highly processed, made in a factory, you're getting a lot of chemicals in there. Those chemicals are going to cause systemic inflammation in the body. So that is the first thing we want to address, because you can't have wellness when you have systemic inflammation. So we want to look at diet. Second thing we want to look at is environmental stressors, such as, a lot of our plastics have BPAs in them. So we want to look at how much plastic. We want to decrease the amount of BPAs is one of the things, but BPAs is a class of endocrine mimickers. So when you look at endocrine mimickers, the body's going to look at that as estrogen. So when you go into that, the body looks at that as estrogen, and it's going to take those receptor sites. It's actually called a xenoestrogen, is the proper term.
mm-hmm,
We want to eliminate those things from our life as well, because it affects not only estrogen, it can affect thyroid function, it can affect a multitude of things.
mm,
So we get that from, just regular plastics and things. Another big thing too is, where do you live? Do you live where there's a lot of construction going on? Are they blasting dynamite into the side of a mountain or whatever and putting particles into the air? Because, they've shown now that microparticles, people that are around microparticles are 50% more likely to develop diabetes. And that's because breathing these microparticles in is causing inflammation. People that are chronically inflamed, it's been shown it can bring on diabetes as well. Those are some of the things that we look at when we look at optimizing the body. We want to rid the body of as much inflammation as we can do.
mm. All right. That was really insightful. So can you share a story of a patient whose complex health issues couldn't be solved by a single approach, but were resolved by your integrated model? And what was the key connection you found that others had missed?
Going back, I had a 26-year-old man that came in to see me, and he was depressed.
Mm-hmm.
So, we do a whole workup on him, and it turns out he had a very low testosterone. It was actually zero. His testosterone was zero in a 26-year-old man. That's not right.
Mm.
So we start adding testosterone into his body, and he started feeling better. Um, I was like, well, that can't be it, because now he came back in because he wanted to have children. He couldn't have children. So we look at, well, why did that happen? Well, when you give somebody testosterone, decreases the amount of sperm they make. We added HCG to it,
Mm.
and that helped him produce testosterone. But when we dug deeper, all this started after a car accident. So what this man had a car accident when he was 24 years old, and he had a closed head injury. That closed head injury damaged his pituitary gland, so then he couldn't produce the signaling hormones needed for his body to make testosterone. So I thought that was an interesting case. It was one of those things you just have to dig a little deeper to figure out what happened.
Wow, that's indeed an interesting one there. So, Dr. Bennett, for the data-driven professionals listening, what does the diagnostic process look like at your clinic, and how do you gather and analyze data to create a personalized system blueprint for a patient's health?
How I do it, my favorite diagnostic tool is an ultrasound,
Mm.
because you can use an ultrasound and you can look at that joint. You can look at the shoulder, you can look at the knees, elbows, you can look at any joint in the body in live time. You can move that joint, you can see how it moves. You can look for any dysfunction, any abnormal movement, any tears in those muscles. You can look at the labrum, you can see if the labrum's torn. You can see rotator cuff in the shoulder, if there's any tears there. So you can see exactly what's wrong in live time. And then you know what you need to do to fix it. So we use that same ultrasound to guide the needle in. So when we put the stem cells in, we know exactly where they're going, and we can ensure that they're going where they're supposed to be going.
Okay, fantastic. So, looking at the future of medicine, what emerging technology or treatment in regenerative medicine are you most excited about that could fundamentally change how we approach aging and chronic pain?
I think on the horizon, I think peptides are going to be the future of modern medicine.
Okay.
Now,
So, why would you
there's,
say so?
there's over 700 peptides that we've discovered. Peptides, 1941 was actually the first peptide discovered, and it was insulin. The
Hmm.
discovery of insulin changed medicine. That saved many people's lives. Now, come 80 years later, we've discovered 700 of them. Some of these peptides, we don't even know what they do yet. But others, we have a very clear understanding what they do. And we can use these peptides and we can actually increase overall lifespan with them. And I think that's where the future of medicine is going. I think you're going to start seeing people live longer, healthier lives, a more complete quality of life as we get older. So you're not going to see people aging the way they currently are aging, where
Hmm.
the the last 5 or so years are a very low quality of life. I think you're going to see people live a higher quality of life up until it's time to leave this world.
All right. So, for you, what has been the biggest challenge in bridging the worlds of traditional chiropractic care with advanced regenerative therapies, and how did you overcome it?
The biggest obstacle for me is when patients come in and they see the traditional medical model and they see that as the only way to address their problem. When
Hmm.
there's a lot more out there than people are being told. And some people come into it with a closed mind and they're not willing to hear that there's other things out there. For example, regenerative medicine. A lot of people, they've done the cortisone shots, they've done the braces, they've done the medications, nothing worked. It's all they know. So they don't give the regenerative medicine a shot. That's been the biggest challenge. And we've been able to educate people. For example, appearing on a podcast like yours, we've been able to educate people on what regenerative medicine is and how it can help them. And my opinion, I do think this is the future of medicine as well.
All right. So, for someone who feels like they've tried everything for their fatigue or pain, so what is the first most accessible step you would recommend they take to start looking at their health as an interconnected system?
If somebody is fatigued, the first thing is getting some labs, getting a proper workup, because there's many things that cause fatigue. It's not just, one thing, X causes Y. That's not it. Many things cause fatigue. For example, people can be anemic. They can have low on certain vitamins. That'll cause fatigue. Maybe they're not going into a full sleep phase. They're not going through all 4 stages of sleep. Maybe that's causing their fatigue. They're waking up groggy. Certain medications they're taking throughout the day. Maybe that's causing their fatigue. So getting a proper workup would be the first step. We got to figure out exactly why you're having that fatigue and what we need to do to help.
All right, that was really insightful. So, Dr. Bennett, if you could get every medical student to learn one thing about the body's innate ability to heal and regenerate. So, what would it be?
The body needs no help, no interference. That would be
Hmm.
my number one insight, that I could impart one piece of knowledge onto students. So that being said, and what I mean by that is the body will heal itself. We just can't keep impairing that by eating a lot of junk food, being around a lot of chemicals, like we talked about before, being around construction sites where if you live by that, they're blasting all around. There's particles everywhere. Living by a major highway, these sort of things. These are going to stress your immune system, and it's going to make it more difficult for you to maintain wellness.
All right. So, what has been like the most rewarding or surprising outcome that you've witnessed in a patient who fully embraced your functional system-based approach to health so far?
Yeah, this is why I come to work every day. I get to see people walk into my office in extreme pain, and within a couple weeks, it's gone.
Hmm.
This lives. We have people that they weren't able to play with their grandkids. They weren't able to go on vacations. They weren't even able to walk downstairs or go down a hill. It completely changes their lives, and they can live life the way they want to live it. That's been the most fulfilling thing for me.
Yeah, that's really indeed fulfilling. So, if you could go back and give your younger self, the one who is just starting in chiropractic, one piece of advice, so what would it be?
If I could go back, I would learn. I would tell myself to start the regenerative medicine earlier.
Wow.
Start offering earlier.
So why is that?
It changes people's lives. I mean, it is a major thing to watch somebody, you know, go from crutches to walking normally. It's the most satisfying feeling, and if I could give myself that feeling at a much younger age in practice, that's what I would do.
Awesome, awesome. Part of the theme of this podcast is centered around innovation. So, for that reason, I like to reserve one question on innovation for every guest that we have a conversation together on this podcast. So, in your work, which is all about integrating different disciplines to optimize the body's performance and longevity, so what does the word innovation truly mean to you?
Innovation is, to me, it's not always about discovering new therapies or new treatments, etc.
Hmm.
Sometimes the treatments are already there, they're just being used in a different discipline. For example, some of the things that we use every day came from another industry, such as aircrafts. We use we use NASA's developed many things that we use in our day-to-day lives that really wasn't designed for our day-to-day life, but it's been adapted. So I would say innovation is not always about discovering things. It's taking things from other areas and adapting them into what you do. Probably the best example I can think of right now would be like the drive-through window at restaurants.
Hmm.
That didn't originate in the restaurants. That originated with dry cleaners. So the restaurants took it from the dry cleaners, but it was a major innovation for the restaurants to have a drive-through window, but they didn't discover it, but it was a big innovation and it came from somebody else. So just kind of keep your eyes open. You never know what other industries are doing that you could bring into your industry, and it could change your whole industry.
Great, great. That's a really insightful perspective. So, finally, for our listeners, For our listeners who are inspired to learn more about, this integrated approach to health that you offer, so what is the best place for them to connect with you and Elk River Medical?
They can go to my website. If they want to learn more about us, they can go to our website, and that's www.elkrivermedical.org.
All right. So it's been a really insightful and interesting conversation with you, sir. And I am totally excited and honored to have this conversation with you on the show today.
Thank you for having me. I've had a great time.